Thank you very, very much. As always, you always give us information that we can use. And talking about vitamin A, we'll talk a little bit more about that in a few minutes. But let's give you that telephone number, the telephone number for any of the products that Sister Kashakia has mentioned or that I mentioned. The telephone number to call, betterhealthherbs.com. Well, it's 541 791 8400. 541 791 8400 for the folks there at betterhealthherbs.com in Albany, Oregon. That's their website, betterhealthherbs.com. And again, we do not receive anything from the sale of any. I don't receive anything from the sale of any of these products. So that being said, let's go back now and let's detail some information about vitamin A, because Sister Kashaki brought up the subject of how valuable vitamin A is, and it is. Vitamin A, and here it is up on the screen here. I'm looking at it. And you get vitamin A, and I think you get about 60 capsules or something. And I'm looking at the price here. It's $3.99. Now nobody's going to get rich doing that, are they? $3.99 for the vitamin A. Well, that's all it costs. That's it. When you are not overcharging people and you're helping them and so forth. That's all it is, $3.99. So I thought I'd mention that. Now now I've got the vitamin A report from the University of Maryland Medical Center, and what they're saying about vitamin A, retinol, kind of an overview. Vitamin A is a fat-soluble vitamin that has several important functions in the body. It helps cells reproduce normally, a process that's called cellular differentiation. And vitamin A, retinol, is essential for good vision. The first sign of a vitamin A deficiency is often poor sight at night. You just can't hardly see, at night, and for night driving. Increase your vitamin A and see if that helps. And vitamin A is needed for proper development of an embryo and a fetus. You got to have vitamin A. Vitamin A helps keep skin and mucous membranes that line the nose and the sinuses and the mouth. It helps keep all that healthy. And it also plays a role, vitamin A plays a role in the immune system function, in growth, bone formation, reproduction, and wound healing. Vitamin A, it comes from two sources, one called retinoids, that come from animal sources, and also includes retinol, and the other group called carotenoids, which Sister Kashakia said she's going to get into a little more next week. And the carotenoids, well, it comes from plants and includes beta carotene. The body converts beta carotene to vitamin A. And major carotenoids, including lycopene, lutein, and zeaxanthin, have important biological properties, including antioxidant and photoprotective activities. If vitamin A, it's rare in the developed world to have a serious deficiency of vitamin A, but it's possible, and the symptoms would include dry eyes, night blindness, diarrhea, skin problems could be a sign that you're have a deficiency of vitamin A. And while vitamin A is essential for good health, it can be toxic in high doses. Never take more than the recommended daily allowance without first talking to your doctor, your healthcare provider. And acne, psoriasis, and other skin disorders, prescription creams and pills containing retinoids, a synthetic form of vitamin A, are used to help clear up severe acne and psoriasis. They have also shown promise for treating other skin disorders like warts and premature aging from the sun. And recent studies show that topical forms along with antioxidants may help minimize the appearance of fine lines and wrinkles. Now, these medications require close supervision by a doctor, and isostratonin, Accutane, an oral medication for acne, can cause very serious side effects and must not be used by pregnant women. Yeah, Accutane shouldn't be used by pregnant women or women of childbearing age who are not taking birth control. So Accutane. And eye disorders and vitamin A. Getting enough vitamin A in your diet is essential for good vision. Research shows that people who eat more foods with vitamin A are less likely to develop age-related macular degeneration, AMD. In addition, a large population study found that people who got high levels of vitamin A through their diets had a lower risk of developing cataracts. But researchers don't know whether taking vitamin A supplements would work the same way as getting it in your diet. And vitamin A supplements may help slightly slow down the damage from retinitis pigmentosa, a hereditary disease that causes poor night vision. However, the study used high doses, which can be toxic. So, they didn't do it right. And they do that a lot with natural remedies. Measles. What about measles and vitamin A? For children who have a vitamin A deficiency, supplements can reduce the severity and complications of measles. Children who are deficient in vitamin A are more likely to develop infections, including measles. And in areas of the world where vitamin A deficiency is widespread, or where at least 1% of those with measles die, the World Health Organization recommends giving vitamin A supplements to children who have measles. However, vitamin A does not seem to help unless a child has a vitamin A deficiency. In other words, if they don't need it, it's not going to help. Never give a child vitamin A supplements without a doctor's supervision. We want to make sure that the child needs it, and we get the correct dose. Inflammatory bowel disease, that's another thing that vitamin A can come in handy when there's IBD, inflammatory bowel disease. People with IBD, either ulcerative colitis or Crohn's disease, may have a hard time absorbing all the nutrients their bodies need. Doctors often recommend that people with IBD take a multivitamin, including vitamin A. And with cancer, vitamin A can reduce the risk of cancer Well, whether it can or whether it can't, well, it's really not clear. People who eat a healthy diet with enough beta carotene and other carotenoids from fruits and vegetables seem to have a lower risk of certain cancers, such as breast cancer, colon cancer, esophageal cancer, cervical cancer, and melanoma. Some laboratory studies suggest that vitamin A and carotenoids may help fight certain types of cancer in test tubes. That's what some laboratory studies suggest. Now, few studies have shown that taking vitamin A supplements will help prevent or treat cancer. They haven't, there's no studies that really have shown that. In fact, there is some evidence that it may be harmful. Taking beta carotene or vitamin A supplement has been linked to a higher risk of lung cancer in people who smoke or drink alcohol. However, some researchers say more studies are needed to confirm this, and I'm sure it's not confirmed. So we really need more research to say those kinds of things. Now, one preliminary study suggests that a topical form of vitamin A may reduce abnormal growth of cells on the cervix, called cervical neoplasia. Researchers are also investigating retinoids, a synthetic form of vitamin A, for skin cancer. And people with certain types of skin cancer tend to have lower levels of vitamin A and beta carotene in the blood. However, studies that have looked at whether taking higher amounts of vitamin A or beta carotene would prevent or treat cancer have mixed results. They haven't confirmed it. Now, dietary sources, well, vitamin A in the form of retinol palmitate is found in beef, calf, and chicken liver. It's also vitamin is found in eggs, fish liver oils, and dairy products including whole milk and whole milk yogurt, whole milk cottage cheese, butter, and other cheeses contain vitamin A. The body can also make vitamin A from beta carotene and other carotenoids, which are fat-soluble nutrients found in fruits and vegetables, and give them their color. Most dark leafy green vegetables and deep yellow-orange vegetables and fruits, and sweet potatoes and carrots and pumpkin and other winter squashes, things like cantaloupe and apricots and peaches and mangoes, they all contain substantial amounts of beta carotene. And by eating these beta carotene rich foods, you can increase levels of vitamin A in your body. And of course, there's vitamin A supplements are available as either retinol or retinol palmitate, and tablets or capsules are available in a variety of doses. The tolerable upper limit or safe upper limit is 10,000 IUs, which is the reason why the Better Health Herbs product there that I showed you earlier is in the 10,000 size. That's the size of it. And for any dose close to that amount, a doctor should help determine the amount to take. Most multiple vitamins contain the recommended dietary allowance, the RDA, for vitamin A. Unlike vitamin A, beta carotene does not build up in your body. However, there is some evidence that high doses of beta carotene can carry some risk. You want to talk to your doctor about that as well when you're taking beta carotene. Anyway, how to take it. Vitamin A is absorbed along with fat in the diet, so take it with food. Studies often use high doses of vitamin A. However, such a high dose can be toxic. So it's rather silly to do that, but they do that. A doctor should monitor any high dose therapy, and any dose that is approaching the level of 10,000 IU's for an adult or above the recommended daily allowance for a child. And then here's what the daily intakes are. Pediatric, for an infant who could use some vitamin A, well, from birth to 6 months, the dose would be 400 micrograms. And infants from 7 to 12 months, 500 micrograms. Children from 1 to 3, 300 micrograms. Children from 4 to 8, 400 micrograms. Children from 9 to 13, 600 micrograms would be a daily dose. Boys, 14 to 18, 900 micrograms. Girls, 14 to 18, 700 micrograms would be a pediatric dose. Now, an adult dose, a man 19 years and older, well, the general daily dose would be 900 micrograms. And women 19 years and older would be 700 micrograms. And pregnant women 14 to 18, 750 micrograms. Pregnant women 19 years and older, 770 micrograms. Breastfeeding women should get, at ages 14 to 18, should get 1,200 micrograms of vitamin A daily. And breastfeeding women that are 19 years and older should just get a little bit more, and that is 1,300 micrograms. And that's the dosing. That is the dosages for children, for babies, children, infants, adults, and the precautions. Well, the precautions with vitamin A, because the potential for side effects and interactions with medications, you should take dietary supplements only under the supervision and knowledge of a healthcare provider. In other words, we need to make sure what you're getting in all your different supplements. Maybe you're taking a multiple vitamin that's already got 1,000 micrograms of vitamin A, or maybe it's so. We want to make sure from all your different supplements that you're taking that you're not overdosing in anything, including vitamin A. Taking too much vitamin A when you are pregnant can cause serious birth defects. Because all prenatal vitamins contain some A, you should not take a separate vitamin A supplement besides. See, there's what I'm talking about. You want to watch getting multiple sources of the same thing. Now, synthetic vitamin A can cause birth defects. Women who are pregnant or trying to become pregnant should never take a synthetic vitamin A. Now, too much vitamin A is toxic and can cause liver failure, even death. Sometimes symptoms of vitamin A toxicity include you'd get a headache, fatigue, muscle and joint pain, dry skin and lips, dry or irritated skin, and nausea or diarrhea, and hair loss. All of these from toxic amounts of vitamin A. We're talking about over 10,000 for a prolonged period of time. Now, vitamin A from foods is considered safe, but you can get too much from supplements. For adults 19 and older, the tolerable upper limit for vitamin A is 10,000 IU's per day. That's the upper limit. And again, we'll talk to our doctor or health care provider to make sure that you're not getting vitamin A from other sources and so forth, and so that we don't have an overdose of vitamin A. Now, people who have liver disease or diabetes should not take vitamin A supplements without a doctor's supervision. Smokers and people who drink heavy amounts of alcohol should not take beta carotene supplements. And both vitamin A and beta carotene may increase triglycerides, which are fats in the blood. And they may even increase the risk of death from heart disease, particularly in smokers. So vitamin A is found in many different vitamin formulas, supplements that say wellness formula, immune system formula, cold formula, eye health formula, healthy skin formula, or acne formula, all tend to contain some vitamin A. If you take a variety of different formulas, you could be at risk for getting too much vitamin A, and that's, so I think we've made that clear. So if you take large doses of vitamin A, you may want to avoid eating carob, because carob increases the amount of vitamin A available in your body. And here's the possible interactions of vitamin A. If you are being treated with any of the following medications, you should not take vitamin A without first talking to your healthcare provider. Tetracycline, antibiotics. People who take a type of antibiotic called tetracyclines, well, they also take high doses of vitamin A, may be at risk for a condition called intracranial hypertension, which is a rise in the pressure of brain fluid. Tetracyclines include democlocycline, or declomycin, and minocycline, minosyn, and tetracycline, which is also called acromycin, and another thing, antacids. One study suggested that the combination of vitamin A and antacids may be more effective than antacids alone in healing ulcers. And what about anticoagulants, blood thinners? A long-term use of vitamin A or taking high doses may increase the risk of bleeding for those taking blood-thinning medications, particularly warfarin, Coumadin. Talk to your doctor about taking vitamin A if you're taking those. And cholesterol-lowering medications, like bile acid sequestrants. The medications cholestyramine, right, or Questram, and cholestyramine, which is also Cholestid, may reduce your ability to absorb vitamin A and lead to lower levels in your body. A water-soluble form of vitamin A may help. Another class of cholesterol-lowering medications called statins may actually raise vitamin A levels in your blood. And doxorubicin. Doxorubicin is a medication used to treat cancer. And test tube studies suggest that vitamin A may make the action of doxorubicin stronger. And more research is needed to understand the effect. And if you're undergoing treatment for cancer, ask your oncologist before taking vitamin A or any supplement. Medications processed by the liver. When you're taking high doses of vitamin A along with some other medications that are processed by the liver, may cause liver damage or even liver failure. Some examples of medications processed by the liver include acetaminophen, Tylenol, and carbamazepine, Tegretol, isoniazid, which is also methotrexate. And if you are taking any prescription medications, ask your doctor about how they would react with vitamin A. And neomycin, mycifradin. This antibiotic may reduce the body's ability to absorb vitamin A, especially when taken in large doses. And if you're taking Prilosec, or omeprazole, used for gastroesophageal reflux disease or heartburn, that vitamin A may interfere. So those may interfere with beta carotene supplements if you're taking that Prilosec. And researchers do not know whether it also affects the absorption of beta carotene from foods. They don't even know. And retinoids. Uh, these medications are a synthetic form of vitamin A, and are sometimes prescribed in high doses. And people who take retinoids should not take an additional vitamin A supplements. In addition, these drugs can cause severe birth defects. Women of childbearing age must have 2 negative pregnancy tests and be on 2 forms of birth control before taking retinoids. And anyone taking retinoids will be monitored closely by their doctor. And retinoids include actritin, which is also soratane, and bexarotin, which is also targetin, and isotretinoin, which is Accutane, and tazarotene, which is also called Avage. And and there is tretinoin, which is retin A, is usually prescribed as a skin cream to treat acne or reduce wrinkles, and is not as concentrated as other retinoids. However, you may still want to avoid taking vitamin A supplement while using retin A. And there's orlistat. Orlistat, Ali, or Orlistra. Orlistat, a medication used for weight loss. Orlistra, a substance added to certain foods. Both prevent the body from absorbing fat and calories. They may also prevent the body from absorbing enough vitamin A. The Food and Drug Administration, the FDA, requires that vitamin A and other fat-soluble vitamins, vitamin D and E and K, be added to food products containing Olestra. In addition, people who take either prescription or Orlistat or over-the-counter Ali may want to take a multiple vitamin as well. So that is it. That gives us a real bird's eye view of vitamin A and a lot of information regarding vitamin A. We are coming to the top of the hour, and I want to take a moment here and invite everyone to open up their mics. And if you have a comment or a question, if you have something you want to know about, please ask that question now. I'm going to unmute the mics for just a moment, give everybody a chance to ask a question or make a comment. So go ahead and ask a question or make a comment. Do you have a question or a comment? Okay, the lines are open. We're taking questions. If you have any kind of a question, you want to know about a natural remedy or an herb or a vitamin, now's a good time for us to talk about that. Okay, we're not getting any questions.
Hello?
Hello there.
Hello?
Yes, hello in New York.
Hi. Yes, hi, Dr. Truman.
Hi.
I wanted to ask a question about the ginseng. I happen to take ginseng in a tonic form. Now, you said that a person should stay off it for how long? Like a week or something?
Uh, when we were talking about ginseng, and I'm muting out the mics now so that we don't get an echo. When we're talking about ginsengs, we talked about uh, uh, going on them for what did we say, 3 days, or excuse me,
You said 3 weeks.
3 weeks,
You said 3
yeah,
weeks.
three weeks, and then take a week or two off. Take a week,
Uh-huh.
yeah, take a week or two off, and rest from it, and then go back again. Let your body, because we don't want to keep pushing. We want to feed the body and and give it a lot of nourishment, and then we want to give it a break and let it recover, let it do its own thing. We want the body to go back to work and learn to balance itself out. So, what these nutrients are for, they're to help us and comfort us, to get us back to where we are in charge of every part of our own physiology. And then once we have nourished, whether it's a sore shoulder or whether it's a sore liver, once we have got it going again and it's all right, then we can back off and stop taking it. That's the interesting thing about that joint care formula number 1043 that got rid of my arthritis and rheumatism pain that I had for 7 years after an automobile accident. And it took me that long to develop a formulation that absolutely got rid of all of my aches and pains, and I could go back to working out with weights again. I have all the it's. I couldn't believe that it worked so well. And then other people said, well, let me try it, and they got the same results. It was so interesting. Some things you have to take for weeks and weeks and weeks. This you take for the first day. You start getting results of no inflammation, no pain within hours of taking this joint care herbal tincture extract. Number 1043, called joint care. It's a lot more than joint care, because the secret to that formulation, and what finally unlocked all the potentials of the arthritic herbs, the pain formulas, all of the 68 different herbs in there, and how it unlocked them all was when I added a multiple cancer herbs and formulas into that formula and compounded it just right. It all worked. It because though the cancer cleaning, blood cleaning herbs just cleaned all of that out of the sore, aching muscles that were aching with arthritis and rheumatism and aches and pains, and it renewed the cells. Uh, it, and within 3 days, I didn't have to take it anymore. I forget to take it, and until every now and then when I'm pushing myself too hard and not getting exercise like I should, sitting here doing these reports hour after hour after hour, then I noticed that after a few days of doing that, then I start seeing feelings of aches and pains. Well, that's because I'm not getting any exercise like I should, and I keep pushing myself. Yeah, so it comes back, and I get aches and pains. Then I take that arthritis formula, boom, it puts me right back on track again. No aches, no pains, and then I'm good for a week or 2 weeks until I do the same thing again. It's funny how we do these things to ourselves. We know that we should get more sleep. We know that we should eat the right things and do the right things. But, nobody is perfect, and I am not perfect either. It is a good thing that the Lord has been so wonderful to me, that He gave me all these remedies, so that when I'm not perfect, that I could reach for a remedy and get back on track again. But that's how that does work. Is there any other question, my friend?
Yes. Also, I have two questions about licorice. You know, you often.
Whoops. What happened here? We got disconnected. That was interesting. It okay, we got disconnected. We got we were temporarily disconnected, and I don't know how or why. But we got
Oh,
temporarily disconnected
can
for a
you
moment. But we're
can you
back.
hear me?
So you
Okay.
were
Can you?
interested about licorice. What about licorice?
That I hear that it can raise your blood pressure.
It can, and but it's wonderful for the adrenal glands, and it feeds the adrenals and it gives you lots of adrenal energy. But if that heart is weak, it can push the heart, and the heart says, "Well, you may have made the adrenals happy, but you put stress on the heart, so that's not going to work." So that's why licorice works that way. It You have to be very careful with the licorice if you have a weak heart or you're predisposed to heart problems. So what we do is we get a heart formula, an herbal heart formula, and and when you take the heart formula, strengthens the heart muscle, and there are a lot of things you can do for the heart. There's that heart report that's under in the herbalhealthreview.com website, herbalhealthreview.com website, clicking on common conditions and clicking on heart is going to give you a heart formula. I think it's number 1222. And that herbal tincture extract is what I use when I pushed myself beyond my capacity, have not gotten enough rest, and I'm still pushing, and I can tell my heart is telling me, slow down. I'm at 75, I'm and I push myself like I'm 20. So, so, but I can tell when my heart is being stressed. So I take number 1222. And it enables me to continue to do what I shouldn't do. Now, that's an admission of guilt right there. Where none of us are perfect, but I do push myself. For these reports, I do very often. I do 14, 16 hours sitting here working on reports and doing research, and I shouldn't be doing that. I need to get up, get around, and so forth. But sometimes the time just flies by. So anyway, yes, licorice root, you can take it if your heart is strong. How do you keep your heart strong? With heart herbs like that number 1222 herbal heart formula. And that herbal heart formula, number 1222, it has hawthorn leaf, hawthorn berry, motherwort, ginkgo biloba, tansy that regulates the heartbeat, fenugreek that really feeds that heart, garlic, which is a natural antibiotic and a heart strengthener, and cayenne pepper. And it's all together in one formulation, number 1222 herbal extract, that you can find over there on betterhealthherbs.com. And all of the products that we talked about, the Noni, the AGE products, all of these things, you can call them on the telephone. That's betterhealthherbs.com. That's their website, betterhealthherbs.com. Call them on the phone, 541 791 8400. That's 541 791 8400. That's Better Health Herbs. That's Health and Herbs in Albany, Oregon. It's a not for profit. It's my granddaughter. We are 3 generations of herbalists. I don't own any part of it. And if I did, the FDA and the government would beat me up and steal it from me, because that's what they do. So we've come to the top of the hour, And again, these 2 hours went pretty fast. So we're going to be back again, as always, every Thursday from 3 o'clock Pacific Standard Time. So in New York, that'd be 6 o'clock. So 3 o'clock Pacific Standard Time to 5 o'clock Pacific Standard Time. That'd be 6 to 8 in New York. And we're here every Thursday talking about natural remedies, praising the Most High, giving the glory and the victory to the Father, the Son, and the Holy Spirit, receiving a healing here for the glory and for the victory of the Father and Son. In Jesus Christ's name, amen. Now, I think we just about did it. Unless somebody had another question, we're going to be signing off for this Thursday, and we'll be back again next Thursday. I'm going to open up all the mics just in case somebody has a last question or a last comment. We'll take that. The mics are all open at the moment. So if you have a question, do you have a question or a comment? Yes, go ahead.
You owe me $500.
Yeah, right. Well, I mean,
Do you have a question? The mic was open, and we're close to mic. But I guess we have no further questions. So thank you for joining us here on Discoveries in Health. All praises to the Most High. Talk to you again next Thursday. Tell a friend and join us here on Discoveries in Health. Thanks.